got to stop this. And if we, the public, do not let them know that we are aware that this is going on and it is not acceptable, they're never going to change. They're never going to change. You see this impeachment inquiry going on right now? It's teaching politicians a lesson. Every potential presidential candidate now knows you're going to be held accountable by a system of people who are going to hold you accountable. So you can't just do what you want to do. Do you see what I'm saying? We've got to hold the medical establishment accountable. If you're going to a doctor and they're in their late 50s and 60s, that means they've been practicing medicine for close on 30 years. You know what that tells you? You know what that tells you? That tells you that they probably have an issue. They probably are not even listening. If they're not, time to change. Sit down and have a frank conversation with them, right? Have a very frank conversation with them about what it is that is on your mind. And if they're not willing to change, time's up. Time is up. My friends, the day and time for us putting up with substandard service based on our class, based on our money, based on what we look like or sound like, that day and time is over. If you are someone who came here from Eastern Europe or some other part of the world and you don't speak English in an American fashion, right? And you speak with an accent and they treat you badly wherever you go, time is up. Time is up. The implicit biases and prejudices, the first thing they think is you don't have enough sense. Some of these folks who come here from other parts of the world were doctors, lawyers, and engineers, scientists and physicists before they came here, and you're going to treat them just because they transferred from a whole other country and now they come here, you're going to treat them like they're substandard and subhuman. This is why people resent the implication. They resent when you put people in a box and call people immigrant, because it sounds like they're uneducated, they're unsophisticated, and they're nobody. Your damn jackass ancestors were immigrants at one point. Do you see what I'm saying? And these are the implicit, and people don't even realize what they're saying. When you do that and you say, well, this is my friend. Yeah, but you're still making derogatory comments about their personhood. I can't begin to tell you as an ethnic person how many times that has happened to me. And I speak, according to them, the standard is to speak English. I speak the Queen's English. You can't even speak English the way that I speak it. But here you are making derogatory comments about my personhood. And you have never walked the ways that I have walked. Do you see what I'm saying? Somebody is making a comment here. Yeah. No, you can talk back to me. I want to hear what you have to say, right? But do you see what I'm saying? So this is why you find then when you go into the medical scenarios and medical environments, you literally have to stand in your personhood and make sure they recognize that you're a person and you are here because you need a service and it is their responsibility. No, you're not intruding. Join in the conversation. You're not intruding at all. Come on, right? You're welcome to join. This is an open forum, right? But do you see what I'm saying? You have to let them know that I'm a person. I'm here for service. And then they're going to adjust. I look like a human being, don't I? Yeah? Right? Yes, you can follow me. Right? I look like a human being. I sound like a human being. Right? So I deserve to be treated with the courtesy that comes with that. I kid you not. These things happen. We have so absorbed these implicit biases, we don't even realize how they translate. And if you don't believe me, you need to go into medical environments. Most of the doctors you see are brown with names that have like 20 syllables, right? And even with them, right? You're welcome. And even with them, they too have implicit biases. They too treat Black people as if they don't matter. What is it that's happening? They're absorbing the attitudes from the establishment. And if you were to have this frank conversation with them, then you would wonder, because and the question I ask is where you come from. You have a caste system where you can't touch certain people based on your caste system. Well, baby, that doesn't happen here. So get with it. You can either go back home and do that, but don't do it here. And here you have a series of recording. There are ways in which you can elocute and demonstrate your dissatisfaction with it. Most of us don't stop to take the time out to do that. So it continues and continues. Do you know it's affecting you? It affects you. Listen to what you say about those experiences. That's how you know it affects you. So you have to deal with it. You have to go back to it and say, this is not acceptable for me. I do not like being treated like that. You need to understand that I'm a person and I'm dissatisfied. So give me the names of the people whom you relate who supervise you, so I can let them know. And see how quickly people change. I'm a person. Treat me with respect. Right? And this is why I tell you all, make sure that you have a patient advocate. You all have that. You all have someone who is your patient advocate. Go to your doctor and ask for it. It's called a durable power of attorney for healthcare. Go get it done. It means in today's world, everything is synchronized, right? So they have access to your chart across multiple platforms, multiple healthcare platforms, which is good. So if you go to another city or something, or you go to another hospital and something happens, they're able to access your chart so they can see your durable power of attorney for healthcare. It appoints someone to make decisions for you in the event that you're incapacitated. I tell folks all the time, don't go to the doctor alone, especially if you're anticipating there's going to be a pronouncement of a life sentence. Don't go alone. Make sure you go with someone whom you have empowered to ask questions on your behalf. And you tell that person, I can't talk, so you make sure you can talk for me, right? You're a dentist from Bangalore, India. No, can I ask you something? Are you living in the United States? Are you practicing as a dentist? I need you to tell me that, because I want to know. I want to know what your experience has been. People are people, and it's time out for us to understand that. Nope, there you go. So you're not practicing as a dentist. What do you do here? Tell us. Because people think when I talk like this, they think I'm, making stuff up. As if I don't hear this from real people. And I don't experience this or have been exposed to it. You see where I'm coming from? Right? So tell me what you do. You don't practice. You're a dentist from India, but you don't practice as a dentist here. I am just saying, right? So you're planning to go to the UK where you will find more acceptance because, I see that. I've heard that. A lot of people have gone to the UK, or sometimes they lived in the UK prior to living in the United States. I see, right? But do you see what I mean? There's so many implicit biases. There are implicit biases and inherent prejudices within the system that prevents the people from understanding and accepting you. I call them the gatekeepers. One of these days I'm going to talk about these gatekeepers, right? They're the people who, when you call to make an appointment, they ask for your demographic information, your date of birth, name, social security number. They can tell where you are, who you are, right? And then when you show up, the way they treat you, they seem to be more accepting and friendlier and more open to people who look like them than they are to you. These are the things that we have to talk about because it affects the kind of care that you're going to receive if you become incapacitated and have to be laid up in a hospital bed somewhere. This is why I tell folks, don't live alone. Have some folk around you. Don't isolate yourself, right? Make sure you have people who love you enough and who are going to want the best for you when you can't do anything for yourself. That's why I tell people all the time, but it sucks to be me. Nobody listens, right? Everybody thinks, I'm young, I'm 50, I'm 55, I'm 60, I'm going to live forever. Right? No, no one lives forever. And we know that because the people who lived a long time ago are not here anymore. So that's enough to say that no one lives forever. Right? Let me hear what my friend from Bangalore says. You seem to be a kind human being. I try. I try. Right? But do you see what I'm saying? And that's all we're saying. Is just try to be human. Even in other fields, in other forums that we go into, people, just be human. You see a human being walking through the door, be human. My daughter was at a restaurant yesterday and a homeless person walked in. And they offered him food, but he didn't want food. He was telling them what he wanted. He wanted money. So he's not about to get any kind of empathy. But people walking, sometimes you don't even know. Yesterday we were, where were we? We were on the road somewhere. Do you know what the temperature was? My friends, it was 22 degrees. We saw a homeless lady. She has everything on her. She had, you know how that is. They probably have on like 3 different coats. She had on everything on her and was pushing a cart, standing at the bus stop. All she's really doing is riding the bus to get some warmth until she can get to the shelter. Because you know how shelters work. They can't get into the shelter, I think in winter they can get into shelters before 5 p.m. but they have to be out by 7 a.m. and during summer during summer it's 7 p.m. So during the day, where do they go? You and I have heated offices to go work in. You and I have heated spaces to go occupy. Where do they go? Nowhere, as it turns out. Nowhere. They walk the streets and they're homeless. Are they a human being? Yes. Yesterday I was driving past somewhere and I know it never occurred to me that the people whom I see under the bridge, it never occurred to me that it's winter. I don't know what I was thinking. And I saw the little encampment and I said to myself, wait. I looked at the thermostat in the car, it's 22 degrees. And I said, wait a minute. Don't tell me somebody's actually laid out onto that bridge in this cold in 22. Because I remember when I was walking to the car, how I felt. A little empathy goes a long way. People are still people. We've become a society, as humans, we've become a society more interested in making money than we are in being human. Consequently, we're ignoring people. No matter what we see people come in, people of color, and immediately we buy into the biases and stereotypes that exist instead of treating people as if they're people. People are people and they're deserving of the common dignity of being human. Let me ask you this. If you were to one day get up and find yourself suddenly and you ended up being in a hospital and you don't look like how you look like this, how would you want to be treated? Right? As society. Thank you, Tony. Right? Thank you. Right? How do you want to be treated? If you couldn't talk or somebody needs to talk for you, but your clothes look tattered because you were robbed or you were attacked and you end up in a hospital, how do you want them to ignore you when you're trying to tell them that something is wrong with you? Would you want them to ignore you? We need to be empathetic. Empathy means putting on what? Putting yourself in someone's shoe and walking around with it. So I said to all of you folks who see Black women walk into your surgery centers, staffed invariably by white women, and the history of racial bias and prejudice is still there, and a Black woman walks in, no matter how much money she has, no matter what she drives, she walks in, and immediately, just because she's Black, you're going to mistreat her, and you're not going to listen to her when she says, I have a pre-existing condition called a pulmonary embolism. You know what that means? That means she can have what? Blood clots. What happened to Serena Williams? She had blood clots. She's an athlete. She tends to have blood clots in her legs. What do blood clots do? They travel all the way up to the lung, and that's when it becomes an pulmonary embolism. She almost died because the medical professionals, the nurses, did not listen to her when she told them. The nurse dismissed what she said and did not pass it on to the doctors. Now, she never said what happened to those medical professionals. I imagine they still don't have a job, because I would have made such a big deal about it. Her family were just really happy, thank you, that she made it. But if it were me, that would not be the end of it. I remember about 5 years ago, prior to my mother's death, and I end on this, my mother had gone to the hospital for a biopsy. This was in 2014. She needed a biopsy to determine where the cancer had been located and spread, right? And after the biopsy, it was minor surgery. It was no big deal, right? So mom was sent home within a couple of days Mom was sent home within a couple of days for just to go back to the hospital. Well, she started to feel bad. God bless you too, right? She started to feel bad. And then we noticed she developed a fever. The first thing I said, oh my God, you probably have an infection, right? So we took her back to the hospital. I wasn't comfortable. Mom worked in a hospital. She was a nursing assistant, so she knows. She says, this feels like an infection, but she didn't want to get the folks whom she worked with in trouble. Me, I don't care. I went back to the hospital. The hospital was trying to cover up what they had done. You know what happened? When they stitched her back after the biopsy, they hadn't cleaned the area, so it created what is called a staph infection, which is common in hospitals, which meant that in 24 hours, she had become bloated and was in such pain. In 24 hours, she would have passed. You should have heard me. I threatened them that I was going to call the local news media to tell them how disgusting they were. They fixed her. They took her back into surgery and they fixed it. Hello, somebody. I kid you not. This happened, right? This happened. So I should remember, there's a Dennis who cares for me in Bangalore, India. Yes, I will, right? This happened. I was there. Tony, I was there. I had to talk up. After that, mom was like, if she doesn't say it, I ain't doing it. I kid you not. You gotta have someone who's a patient advocate. Don't go to the doctor alone. If you know there's something wrong, make sure you have a series of questions to ask and go with someone. Appoint someone as your backup. Appoint someone who is empowered to make decisions for you and to ask questions. And don't hide it from your family members. Let them know, because perception is everything. When mom was going for the first surgery, they told us, we were gathered waiting for her. So they said, are you her family? Yes. And they said, well, we've prepped her for surgery. Do you want to see her one last time before she goes under? And I'm like, yep. And when we went in, mom was laying there with about 5 other people, and everybody was just kind of like, nobody was saying anything. And I'm like, so I looked at her and I said, hello, this is my mother. She is about to have surgery. Who is in charge here to come and attend to her? Because she looks like she needs some help that I can't give her. Just by saying that, the entire surgical unit surrounded her and said, it's okay, don't worry about it. You can go back outside. We have your mother. She'll be out in just a few hours. She'll be out in 5 hours. The doctor will come and give you updates. She'll be fine. And mom did this before she went under. And I was like, I can't believe it. So afterwards I asked mom, I said, what was that all about? Mom said the perception is that if you go to the hospital and you don't have family who care about you, then they treat you like you're nothing. So she said, you gotta have family who are involved. I've never forgotten that. So make sure that in your process, you have someone who is on your team, who is on your side, and who's going to make sure that you receive the kind of care that you need, right? One of my viewers is saying something, just to look at their profession, I have to care their lives are more important. Absolutely. Absolutely. And part of it is that when the profession of medicine was established, the way they, taught them, they're gods. Most doctors have a godlike complex, right? They feel like they're God. They're like, after all, life and death is in my hands every day. And I'm like, Negro person, you look like someone. I'm like, you are a sad replica of a human being, because you're just a human being who one day will be down on it. I'll tell you a funny story and I'm done. A few years ago, a guy I know is a cardiologist. And he's a cardiologist, but he was overweight. And the joke was among his friends was that, how are you a cardiologist, but you're overweight? He said he liked food. How he coped with what he saw was he ate, and he liked to eat. Well, check this out. So one night he was at one of these hospitals around here, and he was on his way home. And he made it home, and then he told his wife, call the ambulance. When the ambulance comes, tell them so-and-so, and tell them to call ahead that Dr. So-and-so is on his way. The same hospital that he just left his patients at, he ended up being a patient. He had a heart attack himself, and he was giving the EMT instructions on what to do to prolong his life on his way back to the same hospital that he had just left. A little bit of humbling. Afterwards, when we asked him how he felt, he said totally human and humbled. I was a doctor and they cut me down to my skivvies. I was naked, laid out on the table, and I had just left there. And I'm like, wow, how humanizing that is. Fancy that, you got treated like a human. Right? And so I gotta go. And so these are the considerations that all of us need to employ in order to prolong our health and to ensure that we continue to be healthy, right? I thank you so much for listening. You have been a great audience this morning. Thank you. And I ask you, if you're a medical professional, please be empathetic to all of us. But especially for those of us who are not medical professionals, I suggest that you educate yourself, become more knowledgeable, and ask questions. And if you're not satisfied, you need to speak up. And don't say, well, if I speak up, they're going to treat me bad the next time. Go somewhere else, right? That's what I've had to do. I'm like, if I'm not going to get the service I need, then I'm going to leave, because this is not acceptable for me as a human being, right? Humanize yourself, right? Humanize yourself. All right. Thanks so much, everybody. It's Friday. Have a great weekend. Be safe, because these roads, it's full on winter in fall. Winter doesn't officially start until December 21st, but you never know around here, right? Thanks so much. And do me a favor, everybody, go out there, reminding me to say this, go to my website, theexodusfoundation.com, and make a donation so that we can continue to be on the air. Thank you so much. theexodusfoundation.com. You will know it's me because we'll have my pic. I look like me. I look like me, right? Thanks, Tony. Thanks, everybody. Thank you. Thank you. Thank you. Be blessed. See you on Monday. Right. Thanks so much. Bye.